Hey everyone, it's Wednesday, time for a little Wisdom Wednesday. Today I wanted to talk with you a little bit about hair loss. I've had quite a few patients who've been complaining lately, and actually throughout my practice history, this has been an issue for many women, and just kind of wanted to walk you through a little bit about it and perhaps give you some of the different things that my patients have tried as far as trying to manage this issue. We know that hair loss is very common. At least 50% of women by the age of 50 have noted some hair loss to some degree. With aging, we know that the hair shaft itself becomes thinner, and therefore, all of us, whenever we check our ponytail consistency, we notice that it's a lot thinner than when we were younger. So, this is just a part of it, is just a natural part of the aging process, and the fact that the density and the thickness of the hair follicle itself will diminish, which then translates into thinning of hair for sure. A lot of it is tied into our enzymes, and of course, at the end of the day, it all has to do with hormones, and as Dave Asprey says, hormones and mitochondria. Mitochondria are those little areas within the cells that produce energy. And the hair and scalp itself, the process of growing hair and producing a good, healthy head of hair requires quite a bit of energy. And the mechanisms within our body and our cells that produce that energy over time become less and less efficient. So this is not an area that is uncommon by any means. And certainly there are disease entities that can contribute to significant hair loss. But for women in particular, we know that much of this is understanding what is considered normal and what is considered abnormal. We know that there are certainly scarring issues that can occur, but to see some changes within the overall quality of our hair and the amount of hair is it's common to just see changes occur. Let's just put it that way. Now, when we look at hair loss and hormonal part of hair loss, we all tend to think that it's either testosterone or thyroid because these are the major hormones that we see. But I will tell you that when I really can evaluate someone's medical history and the testing that we do here in our office, the vast majority of hair loss that we see, at least in these episodes where women feel like they just look at the shower or in the sink and there's just tons of hair, typically comes after some type of major stress. Not always, but very often. And the hormone involved there is cortisol. Cortisol is one of those hormones that, because of changes that occur in this sort of fight or flight and this episode of just survival, if you will, the changes that occur with that in terms of what happens on the hair of the hair on top of our heads is such that, because cortisol is a catabolic event, our hair goes sort of in this, which is a breakdown event. Our hair goes into this breakdown episode as well. And it usually takes about 3 to 6 months for that to, first of all, occur. So often we see it after a major event. And I've been seeing a lot of women calling, particularly after surgeries and anesthesia, and having significant bouts of hair loss. This is usually self-limiting. It comes back, maybe not as much as it was before, but it typically is self-limiting and does come back. But when we look at other hormones, in particular testosterone and thyroid, we see that for women, there is a small number of women who do have male pattern baldness, but for the most part, it's global and oftentimes related to either, more frequently than not, too little thyroid, but it has been shown in some instances to be too much thyroid. So we'd like to have a really good balance of thyroid hormone. I have certainly seen literature where most women by the age of 60 have some type of thyroid dysfunction. And we know right now we're in the midst of COVID, and with all the high cortisol and the downregulation of our thyroid hormone, it would not be unusual to see significant hair loss. We are about, 5-6 months into this. I will probably get a few more phone calls in the next several weeks about hair loss and trying to evaluate that. And sometimes we do need extra thyroid hormone when we're going through stressful periods. I'd like to also share with you a few of the things that some of our patients are doing these days. We know that minoxidil out there has been used, Rogaine, if you will, and I would recommend if you're going to try that, just do the shampoo and get the male shampoo. It's no problem. Just foam it on your hair. One of the first things that I've done with a lot of folks is I have patients come by and pick up a pack of birth control pills. And in those birth control pills are synthetic hormones. And yes, they are synthetic, but the progestin in there can help stabilize the hair follicle. So what I do is I have patients come pick up a pack of birth control pills, buy a brand new bottle of whatever shampoo they like to use, and just open up the pills and put them in the shampoo and let them dissolve overnight, and use that to help stabilize the hair follicle and see if we can't kind of slow down the hair loss process. Often that can be very helpful. The other thing, besides minoxidil shampoo and putting birth control pills in shampoo, there are several other oral supplements. We know that Viviscal and Nutrafol, these have vitamins in them, folic acid and biotin and things like this, can help stabilize. Collagen is very helpful. Be sure that you can put collagen in sauces, you can put collagen in your coffee in the morning. Any type of collagen powder can be very helpful for hair, skin, and nails, in addition to the shampoos that we've talked about. A couple of other websites that I have been told about. There's a product called Nioxin. There is a shampoo called Harkliniken. That's spelled Harklinikken. I think it's out of Denmark. Many patients have done well with that. You can also get a compounded type of serum that you can apply to your hair. These generally contain some minoxidil, perhaps a little finasteride, that is a blocker for testosterone, and spironolactone, some other types of molecules that can be helpful for stabilizing the hair. We also are doing some PRP, or platelet-rich plasma, here in the office, and we have started using stem cells for those of you that can opt for that type of treatment. These are all very delayed type of treatments. We don't see immediate benefit. Remember, this is a long-term problem, and a problem that has to be managed, and not something that you will likely ever get that 20-year-old head of hair again. But these are things that you can continue to manage. So something like a PRP or stem cell would not be necessarily a one-time thing, and it usually takes 6 to 8 months to see benefit. But perhaps every 6 to 8 months you could have some type of treatment that might help if you are really struggling in some of those areas. So I hope this has been somewhat helpful for you. If you have any questions, or actually if you've used things that have worked for you, please let us know, and we'll be happy to share that with patients as well. Hope you all are doing well and continue to create great health in your lives. Have a great week. I'm going to take next week off. I'm going to be out of town, and hopefully on the golf courses up in Utah, and enjoy a little time off. So you all stay safe and stay well. Till next time.